Welcome to this edition of the First Aid Show. One of the main questions we're asked with anaphylaxis are the rules for giving medication out at work, or where a first aider is wondering if they can use a patient's auto-injector to give medication, and similar requests from nurses. The UK Resuscitation Council have covered both these points recently, and also the H.S.E have given advice. The advice given was as follows. If a first aider at work came across a person having an anaphylactic reaction, are they allowed to use the adrenaline auto-injector to give them adrenaline? There is no legal problem in any person administering adrenaline that is either prescribed for a specific person or administering adrenaline to an unknown person in such a life-saving situation. This is possible through specific exemptions in the Medicines Act. However, the first aider involved must be competent in being able to recognise the anaphylactic reaction and administer the adrenaline using an auto-injector. First aiders must ensure that they work within the guidelines of the first aid training organisation that issued their certificate and their employer. The Health and Safety Executive also provided guidance on their website and issued a similar statement to clarify the use of auto-injectors in the workplace. They stated that medicines legislation restricts the administration of injectable medicines. Unless self-administered, they may only be administered by or in accordance with the instructions of a doctor. However, in the case of adrenaline, there is an exception to this restriction, which means that in an emergency, a suitably trained layperson is permitted to administer the injection for the purpose of saving life. The use of an auto-injector to treat anaphylactic shock falls into this category. Therefore, first aiders may administer an auto-injector if they're dealing with a life-threatening emergency in a casualty who has been prescribed and is in possession of an EpiPen, and where the first aider is trained to use it. When we look at what a nurse can do, the answer is slightly different. The question asked of the UK Resuscitation Council was, if a nurse working in an acute hospital came across a person outside a hospital having an anaphylactic reaction, are they allowed to use their adrenaline auto-injector to give them intramuscular adrenaline? The answer by the UK Resuscitation Council was that there was no legal problem in any person administering adrenaline that is either prescribed for a specific person or in administering adrenaline to an unknown person in such a life-saving situation. However, the nurse involved must work within the Nursing and Midwifery Council, the NMC standards, and must therefore be competent in being able to recognise the anaphylactic reaction and administer the auto-injector. Therefore, it would be sensible for trusts or employers to ensure that such a provision is included in their first aid or anaphylaxis guidelines, and if any doubt, ask your manager now before it becomes an issue.